Welcome to the Natasha Helfer Podcast. To help keep this podcast going, please consider donating at natashahelfer.com and share this episode. To watch the video of this podcast, you can subscribe to Natasha's channel on YouTube and follow her professional page at Natasha Helfer, LCMFT, CST-S. This podcast addresses many topics around mental health and sexuality. It may not be suitable for minors. Some topics may elicit a trigger or emotional response, so please care for yourself accordingly. The views, thoughts, and opinions expressed by our guests are their own and do not necessarily reflect the views or feelings of Natasha Helfer or the Natasha Helfer Podcast. We provide a platform for open and diverse discussions, and it is important to recognize that different perspectives may be shared. We encourage our listeners to engage in critical thinking and form their own opinions. The intro and outro music for these episodes is by Otter Creek. Thank you for listening.
Hello, everybody. This is Natasha Helfer of the Natasha Helfer Podcast, where we are going to attack shame any way we can. And today we're going to talk about kind of an interesting way to attack shame, which is through ketamine. So that'll be an interesting topic, I hope, for all of you. There's been a lot of new research on not only ketamine, but psilocybin, MDMA, lots of other substances that have psychedelic effects to them. And with me to talk about this today is Jake Bellenfant.
Hi, thank you for having me. Yep.
Yeah, I'm super excited to have you. For those of you who don't know, Jake Bellenfant has joined our team at Symmetry Counseling, and I'm just thrilled that for the first time ever, we have a psychiatric nurse practitioner on the team. So it's just awesome.
Very excited.
Yeah. Why don't we start off just with a little bit of whatever history you're willing to give? How did you find Symmetry? What made you interested in working with us? And yeah.
Okay, so my name is Jake Clark-Bellenfant. So I am a licensed and board certified psychiatric mental health nurse practitioner. I have dedicated pretty much my whole adult life to mental health. So I've worked in mental health now for 12 years. I started with adolescents in the residential and outpatient setting. And then I've worked as well in the hospitals with the University of Utah inpatient. And I've also worked for juvenile and adult correctional facilities as well. And so currently I practice psychiatry full-time outpatient, and we are getting started here with ketamine, medication management, and ketamine assisted psychotherapy with Natasha. So that's a little bit about me.
Yeah, we're super excited. And just so you are comfortable working with adolescents, what ages are you happy to work with?
Usually high school and up, but I mean, I can go down to junior high. Usually I don't go to the little kiddos. I have before, but there's not my preferred population. So
yeah, right. Okay. So definitely high school and above. And not only will you be working with ketamine with us, but you're also going to be offering med management. So we're just thrilled to have you. But on the topic of ketamine, let's just kind of get into the weeds a little bit. Like, what is it? How does it work? I think a lot of times people hear general ideas about things, but it's harder to get information on what is the ketamine actually doing and how is it functioning in the human body.
Yeah, so ketamine has been around for quite a while. Was approved originally in 1970 by the FDA as a dissociative anesthetic. So most people have heard of it in terms of anesthesia, and that's what it's been used for primarily in the past. But currently we know that it causes dissociation with people but if we talk about the IV states, we'll talk about that later. But at smaller doses can help in psychiatry, which is where it's been studied and has been used more recently. Did you want me to say kind of mechanism of action or?
Yeah.
Okay. Okay.
Yes.
So ketamine, so a little bit, it might be a little confusing, but ketamine basically is a inhibitor of the NMDA receptor, which is a major excitatory receptor in the brain, and it blocks one of the neurotransmitters, glutamate. So this oftentimes, it's used as an anesthetic agent, but this can cause, basically puts people into a more relaxed state. With the small doses that we're using, it's going to help people feel like more loss of sense of personal boundaries, more in union with the universe, or put them into a more suggestible or influenceable state. Does that make sense with the doses that we're using in psychiatry, smaller doses?
Yeah, right. So the larger doses obviously put you in a sleep-like state so that you can have surgery and things like that. But these smaller states, it helps with this, what's called this kind of psychedelic feature, or getting in touch with a different level of consciousness, right? Is kind of how I've heard it talked about.
Yeah, and then we can go into different forms. So IV ketamine, or via infusion, or intramuscular ketamine, oftentimes have like higher what we call bioavailability, or how like the rapid onset of action, how it gets to your body, to your tissues. So that's going to be really high, like about 100% for IV and about 93% for intramuscular. And we're more looking at that as like, that might put people in a more dissociative state where we're not really doing therapy in that kind of a state. Usually we want people, we call it a plasticity window. We'll talk like neuroplasticity, but a plasticity window where oftentimes ketamine assisted psychotherapy with that form is 1 to 2 days after going on, where when we're talking about using our troches, which is our lozenges, oral ketamine or intranasal ketamine, we want to put people not into a full dissociative state and use that with our therapists and guides. Yes.
Right. So, and maybe we'll talk a little bit about what that looks like in a minute as far as the sessions themselves. But my understanding for the most part is that what ketamine is doing is that it is helping heal the neurotransmitters, which you had mentioned earlier. But just to kind of really keep this simple, what even is a neurotransmitter? How do they work? What are they doing in the brain? And how's ketamine helping with that?
Well, the neurotransmitters are like, we have serotonin, norepinephrine, dopamine, glutamate, like we have different transmitters in the brain. But what ketamine does is it helps with neuroplasticity and synaptogenesis. So basically it's helping your neurons form better connections and form new connections in the brain so that those cells are communicating better. And that helps with mood disorders, depression, anxiety. It can help with help our traditional medications to work better, that are focusing on the other neurotransmitters, such as serotonin, norepinephrine. Does that make sense a little bit?
Right. So basically, I mean, because again, when you all medical people speak, I'm always like trying to understand it from a more, much more layperson perspective. So it just feels like if you were going to maybe make the metaphor that there's electricity running in the brain, which there kind of is in a way, that the ketamine is helping those electrical kind of connections and signals get to each other better.
Yes, better, more efficiently, and even form new connections. Yes.
Yeah, and I've even heard of neurotransmitters almost like little clamps, right? Like they're grabbing these serotonin and all these little other things that are. Go ahead.
Well, yeah, the neurotransmitters are often like binding to the receptor, to the, we call it the synapse, and it's neuron to neuron connection, and that the neurotransmitters are the ones that like bind to,
right,
and yeah. So oftentimes there's just hypotheses that in depression that people possibly have less serotonin available in that gap between neuron to neuron, if that makes sense.
Okay. So ketamine kind of helps all of these systems run better. And what do we know about how long? How long does it work? How often do you have to take it? How does it work?
So there's still evidence being researched right now, but from what we have, most from what I've seen, IV-IM ketamine is usually given over anywhere from 2 to 4 weeks, 2 to 3 times a week. So for initial treatment.
Yeah, so it's fairly intensive. I mean, it's like you're having to take off work or make yourself available for several appointments at a time. And this in particular is for some of these more serious conditions like treatment-resistant depression, PTSD, severe anxiety, things of that.
People have active suicidality along with treatment-resistant depression, unipolar or bipolar depression, and it also can help substance use disorders, such as alcohol, and other substance use disorders.
What would you say, since you're bringing up substance abuse disorders, what about the fear of substance abuse of ketamine? Is it
from what I've heard, even people who are addicted to street ketamine, that ketamine treatment can even help with that addiction.
Right.
So kind of surprisingly, yeah.
Yeah. Is there a worry that, a lot of times when people are thinking of taking a new medication, they might be worried that they would get dependent on that medication, even if it's medication that's prescribed. So is that something that, I know we're worried about opiates, for example, in this way, even if they're prescribed, you can get dependent on them. Is that something that people should worry about with ketamine?
I have not read anything in the literature that has talked about people being dependent on it currently.
Okay.
Maybe that we're using it. Yeah.
Yeah, I know people can get dependent on it, like you said, especially street ketamine, but not so much. We're not seeing that as much with.
Also, when people are using street ketamine, they're going to be using it at much higher doses to get more of that dissociative effect, which people sometimes call it like going into the K-hole, is what you'll hear a street term. And that can put people, some people have really bad experiences where they can lose their sight and hearing temporarily and put them in a kind of a frozen state. So,
yeah. Okay.
So they're not, street ketamine could be dangerous because you're using it at a much higher dose, right? And it's not being monitored.
Right. Okay. Yeah. And I think that's important to talk about because especially with the audience I tend to work with, most people are coming from conservative backgrounds. They're coming from maybe they're faith transitioning or have left, high control religions. And even those of us who are like 40 plus remember a lot of the Say No to Drugs campaign. So a lot of people have like a healthy distrust, right, for medications or for drugs or for anything that's considered, kind of an artificial means of dealing with those things.
Register now for Natasha's upcoming Reclaiming Female Sexuality workshop. Use promo code GIRLSDAY to buy 3 tickets or more for $165 each. Make sure to include the names of the others in your group in the comments at checkout. To register, go to natashahelfer.com/retreat. Symmetry is now offering ketamine services. To find out more, go to simcounseling.com/ketamine-services. You can now register for Unwind Together, an exclusive retreat for couples, October 3rd through 6th, 2024, and use the code UNWIND225 for an early bird discount. To register, go to natashahelfer.com/retreat.
What can we do to help them feel like, okay, the environment is safe, this is kind of safe procedures, the dosing is safe? Anything you want to say on that end?
We're doing it within our scope of practice and within the laws. You are being monitored by myself as a licensed medical provider. And then we have therapists who are practicing within their scope, doing the therapy. This is not, to go have fun at a rave, or it's very different. We're not using it for those kind of, recreational effects. We're using it to heal and to combine with either traditional therapy, CBT, or with other first line medications. And if people have been trialed with CBT and it hasn't worked completely, or have been having 2 or more failed medication trials with like our SSRIs or SNRIs, ketamine can oftentimes be a great maintenance add-on or primary therapy for people. Yeah. So if you've had some resistance in therapy currently, it might be something I think worth trying.
Yeah. Yeah. Okay. Going back a little bit to how ketamine works, the way that I kind of have started to understand this after attending several trainings and talking to people like you is that I see as kind of 3 main benefits. One is just kind of the biological benefit, like if you have ketamine inserted into your body, like we've talked about, it helps with these neurotransmitters. It helps with the kind of the wiring in the brain. So even if you don't have a psychedelic effect or even, whatever that experience is, there is some healing that's happening biologically. Is that fair? Would you agree with that?
That is correct. Yeah. And what we're using it in this state, like we're looking more at the long-term effects of it. It might not be as quick as a response as doing an IV or intramuscular route, but those effects are still going to be seen in the long run. It could be 1 to 3 months, yes, but they will be seen.
Yeah, right. Yeah, and just
by most patients, yes.
To be clear, at Symmetry, we're starting with the lozenges and the intranasal. We may go to IM and IV later, but for now, we're starting with that. Okay, so then the second way that I see this ketamine being helpful is the actual dissociative state. If a person reaches that, from what I'm understanding is that this is where it's, you can start having some kind of, access to kind of subconscious thoughts and different ways of kind of considering things that interrupt the kind of classic habits that we get, thinking habits that we get. Really, depression is a thinking habit, right? Anxiety is a thinking habit. It's like your neural pathways are going down the same paths all the time. So it kind of interrupts that and allows for different thought, different perspective, different meaning that can be quite even almost spiritual to people to have.
Yeah. And I've also heard it described by medical providers as like a brain reset almost.
Mm-hmm.
So exactly what you've been describing. Yeah.
Yeah. So the dissociative state itself is very powerful, and people can do some pretty powerful journaling or like we're saying, if you have a guide or a coach or a therapist with you while you're in that state, you can have either some conversations, or if you don't want to converse, the person who's there providing things can be offering the mantras and the discussions that you had previously talked about in these sessions where you prepared your intentions for coming in about what it is that you're really wanting to interrupt in your life right now. Is it a certain thought process? Is it that you're wanting to get past a certain event that you're having a hard time not thinking about anymore, or, all these kinds of things. So that's that second part, is the dissociative state, and what may come to you during that state is different than when you're just tapped into your conscious level only. And then the third thing that I see as a benefit is then, because of that dissociative state and because of the ketamine and biological effects, you are now in a state of neuroplasticity for weeks, if not months, following this ketamine treatment, right? And of course, that goes down a little bit over time. But and what we mean by neuroplasticity is that your brain is in this kind of like constant state of being a little bit more open to differences, to having different thought patterns develop, et cetera. Is that fair?
Fair. Yeah, I would agree with you.
So I think those are three really great things to consider as to why you may want to think about a ketamine treatment. Let's talk a little bit about, so we discussed depression, PTSD, you mentioned bipolar, anxiety, substance use, eating disorders, I've also heard, OCD, even chronic pain. But there's also, so those are all kind of very diagnosable issues, right? That people may have, that they need some help with. They may already be going to talk therapy for many of those things, but this is like an extra oomph, right? To help with those kinds of issues. But what do we know? And maybe this is more a question for me versus you, but what do we know about treating just regular things that people come in for therapy, not necessarily diagnosable? Can ketamine help with that as well?
I believe so. I mean, there's been a lot of also evidencing ketamine assisted psychotherapists using it for couples therapy, for sex therapy, for religious trauma type, adjustment disorder type situations.
Yeah.
As well. Right. I think it can enhance that, your short-term therapy. If you're going through a life transition or something, I believe that it might be able to enhance that as well.
Right. And that's been my experience so far as well, that it's not that you need to have these huge diagnoses, but if you're going through a life event, you're going through a divorce, or you're going through, like you said, a faith transition, or I remember when I went through my divorce, I felt like I was stuck in like old thinking for years, like 2 years, which is when I went and got some treatment like this, and really, really interrupted that in a very wonderful way for me. Yeah, struggling or coping with certain events. I'm very excited to start trying this with couples, like as a form of enhancing couples therapy. So yeah, as you're listening, you can actually, think about, what is it in my life where I feel currently stuck, or that I want to make some progress on? That can be a good question as far as deciding to come to these services. Can you give them a sense of like, okay, somebody says, okay, yes, I'd like to try this. What can they expect? The first thing they do is set up an appointment with you. What can they expect?
Right. Yeah. So, first we'll talk with Natasha's team and see if you're a good candidate for ketamine therapy. We have some like contraindications and policies that we go through there, and decide, are we looking for more guided? Are we looking for more of therapy? And you'll set that up with Natasha and her team. Then when you come to me for your initial evaluation, it is a full psychiatric, diagnostic, and medical evaluation on my part. So the same thing you would get with going to any other psych and peer psychiatrist for an initial evaluation. So in that, I'll do a lot of history gathering. I do a medical history gathering. We talk about what past medications or current medications you're currently taking. I gather family history. I gather symptoms. And then after that point, we'll do more the medical education piece and talk about what meds, the ketamine, and what other medications we can offer at that time.
Right. So kind of a full thing. It's not just for a ketamine assessment. You may give a recommendation that maybe this medicine could be helpful as well, or
yes, I do a full psychiatric medical evaluation for every ketamine patient. So, okay.
And they would also do a follow-up visit with you.
Yes, with me currently for patients that are seeking ketamine, I would like to have some follow-up care with that on my end. So I would prefer at least one follow-up with every patient so that I can assess how did it work? Do we need to talk about another round? Can we talk about other medication options if someone wasn't willing to the first time? Are we going to transition care into somewhere else for general medication management? I just want to be able to follow up and talk about those things after they've gone through their initial sessions. Yes.
Right. Okay. And then just to give you a sense of the public that's listening, as far as what we will do on our end, the therapy guide or coach end, is you'll decide who you want to work with to be in the sessions with you. So I've heard a lot of ketamine centers really just kind of, they set you up and you're kind of in the ketamine room by yourself and you get the medical benefit of it, right? But there's nobody in there really doing any sessions with you. So that's going to be one of the main differences at Symmetry, is that somebody will be in the session room with you, offering you the information that you had decided you wanted during the intention sessions. So that's how it will work. And then you can also decide if you want to do sessions in between the ketamine sessions themselves, and of course, after the whole process is over as well, which helps you tap into that 3 to 6 or weeks to months kind of neuroplasticity that we talked about. You mentioned contraindications. What are some of the reasons why ketamine would not be a good fit for people?
Any history of schizophrenia or psychosis is an absolute contraindication that I'm not going to put people on ketamine for. We'll gather a family history. If someone has a direct relative of having psychosis, that could be a risk. We educate people on. I gather a good cardiac history. I really want to make sure people's hearts are healthy and that they're oftentimes exercise tolerant. One thing ketamine we know does is it does increase blood pressure and it does increase heart rate during administration. Blood pressure usually on an average of 5 to 10 on the systolic side, which is the higher number side. Percentage of patients will get above 100 heartbeats per minute and above, I believe it's 180 over 100 for blood pressure. So I'd have to double check that, but I'm pretty sure. We know it's going to increase those things. So if you already have hypertension or high blood pressure, or if you have heart failure, that might be a definite contraindication for us on our end. And then anyone who is pregnant or planning to become pregnant, I think might be also a risk for us as well, that we might have to discuss doing that afterwards. Mm-hmm. I believe that's, at least on the top of my head, that's it. I know we have policies and consent forms where we did list a ton of them, which we make all patients read through and sign.
Okay.
For some of our contraindications, but those are the major ones.
Yeah, that's the major ones. And are there any risks or side effects?
Oh, and also risks for seizures. If you have a high risk, or if you have a history of seizures or epilepsy, that can also be something I want to look at, a risk. Okay. Side effects. The most common side effect for people is going to be nausea. So with their medication evaluation, I would like to offer everybody either Zofran or promethazine, and I'll be giving that to people so that they can pick that up at the pharmacy, and you can either take it before your ketamine session or after if you're getting nauseous. That's the number one complaint that I've heard. Some people, even at the lower doses that we're doing or with the routes of administration we're doing, can still have some dissociation, and it can be onset days later. I've seen people in the evidence say sometimes dissociation can happen even up to 20 days after starting it. And I have also heard that occasionally it can increase suicidality in patients who've already had suicidal thoughts and are having treatment-resistant depression. So that is one thing that that's why we like follow-up care, and we keep an eye on that. So those are going to be more of your rarer side effects, but they are present in the literature from what I've seen.
Right.
And then also there might be some dizziness or lightheadedness that goes on with that, but those are usually nausea, and maybe the lightheaded dizziness might be more of the effects you might see, along with increase in blood pressure and heart rate. Yeah.
Well, which is why the nausea piece is why I believe people are not supposed to eat anything, right, for about 4 hours before.
Yes. Yeah, that's in our policies. Yeah. So before you come to the office and do your treatment, we would like you to be fasted from food for 4 hours. Yes.
All right. So a lot of people might ask, well, is this covered by insurance? At our clinic, it is not. Do you want to talk a little bit about, I know you also work in a hospital setting. Do you want to talk about the difficulties of having ketamine, just in general, not necessarily through our clinic, covered through insurance or not?
So ketamine right now is not FDA approved as a first-line treatment it has a lot of good evidence, and evidence keeps coming out, but it is currently not FDA approved for treating like treatment-resistant depression or suicidality. So oftentimes we're using that as an off-label treatment that we call it the enantiomer S-ketamine or Spravato, you might have heard on ads and stuff is FDA approved. So there are really strict, we're not using Spravato or S-ketamine in our clinic right now because that has to be monitored through a government program. It also needs to be used in person. Oftentimes we're using a lot of the same guidelines that we're using for regular ketamine for what's been established for S-ketamine. And that's most likely going to be seen down the line if regular ketamine does get FDA approved for these things. But right now it's not normally covered by insurances. I have seen some people get IV ketamine covered, but not everybody. So,
and usually more in hospital settings is what you're saying.
Yes. Yeah.
Okay. And that may be confusing to people. Like, what do you mean it's not FDA approved? Why would I want to, participate in a treatment that hasn't been FDA approved? Do you want to talk a little bit about what the difference is between off-label treatment and FDA approved treatment?
So FDA approved treatment, that's oftentimes drugs take a long time to get approved and they're going through research. It doesn't necessarily mean that the evidence isn't good for it just because it's not FDA approved. The process to get that approved just takes a long time. And as far as off-label uses, we use so many drugs have different uses. So I use so many drugs in psychiatry for off-label use for many different things. So that's pretty standard. And oftentimes a lot of people might have a drug that is FDA approved for one thing, but you're using it for another.
Right. Okay. Yeah. So this is not as uncommon as people might think, but I know that language might be like, whoa, what do you mean? So, okay. So as far as how to prepare for a ketamine session, we did talk about the fasting, but I think we also want to talk about, like, if you're going to go into this kind of treatment, you might want to de-stress for a minute beforehand, right? You may want to not come into it super stressful. Again, we've mentioned several times working with somebody to have intention sessions. We'll have a different podcast talking more about that with the counselors and the guides and the coaches. But this idea that you're coming in with a purpose, right? You have a certain idea. You're going to, again, not that you're going to control where your mind goes when it's, kind of going through its psychedelic effects, but if you come in with an intention, it shows that, that may be on your mind and you may have some ideas about that intention that you're wanting to figure out. But I think too, what would you say about avoiding alcohol or other either recreational drugs or even medical prescriptions that people have? What should they do to prepare for that?
I would say absolutely with any recreational and other substances, while you're going through the course of your treatment, you need to be abstaining from those. If you're doing that before or after, that's your personal, decision. But during our treatment with ketamine, we want people to be abstaining from other substances. And as far as your prescribed medications for the day of, most of the time, that's going to be pretty safe with them. I'm just not going to want anyone to take any major controlled substance. So if we do our medication history and someone is taking a benzodiazepine or taking opioids or something else that can have a sedative effect, I'm most likely not going to want them to take that medication with the ketamine.
Right. Okay.
The way that we're using it. Yeah.
Right. So yeah. And so I think you have to also plan that you're going to have time off, after the ketamine appointment. You don't want to have to be going back to work. You can't drive yourself back home. So you need to have somebody to give you a ride home. Even this idea of getting a good night's sleep the night before, I think can be a good idea, right? So just a little bit focused on self-care and having time to just relax.
Most likely be monitored in the clinical setting for about 2 hours. Is that correct, Natasha?
Yeah. Right. And then we'll even have a kind of a resting area where people can go if they still don't feel like they're ready to leave, but after that 2 hours. Oh, that's another thing that maybe we haven't just talked about is how long is the treatment? I think sometimes Oregon, who's, passed the law that they can use psilocybin, those are 6-hour sessions, right? Or things like that. So how long does ketamine stay in the system? How long is it working for? And yes, our sessions will be scheduled for 2 hours.
Yeah. So ketamine has about another scientific term, half-life. It has about a 2.5 to 3 hour half-life. And then the majority of it should be out within a business day though. So by the time it's the next day, and if you're ready to return to work, you should be good to go. Basically. So about every 2.5 to 3 hours, about half of the drug is going to be metabolized by your body.
Okay. And so when you say a half-life of 2.5 hours, what I've heard is that they can expect to have 45 minutes to an hour of this kind of dissociative state in session. Is that fair? But that doesn't mean that they won't still feel some of those things afterwards. Right. Okay. Which is why it's important to have a ride home and somebody to help you. We are also planning on doing some in-home treatment options as well, where people can do this from the comfort of their own home, but we have not set up all the protocols for that yet. We'll probably start offering that more in the summer, like come July or something. So anyway, so those who are coming in the office, I mean, part of the intentions as well is like deciding what you want to bring with you. Do you want to bring a special pillow? Do you want to bring with you a token of meaning to you? Do you want to bring, a stuffed animal, a special blanket, a weighted blanket, right? So anything that will help you have a positive experience. And then during the ketamine infusion, we'll be taking your vitals when you come into the office, which is like blood pressure, temperature, your weight, pulsometer, right? Is that how you say that? I'm trying.
Yeah, basically how well your oxygen levels are.
Yeah, right.
Check your pulse.
And then you'll have the medication that you will have picked up that Jake will have prescribed, and then you'll take it in the session with the guide, coach, therapist, whoever is there to support you. And that should take hold in about 15 minutes. Anything that you would say that they should expect after, in the following day? You said obviously like you can go to work the next day, you can drive the next day.
You should be able to return to normal function the next day. So after using it.
You can eat and drink.
Yes.
After your ketamine treatment. I've heard about, avoiding alcohol and illicit drugs for like at least 72 hours afterwards. And that 72-hour window is really where you're most like open. That brain neuroplasticity is the most malleable during that time, correct?
That's correct. Yeah.
So even avoiding things like listening to upsetting news and listening to upsetting movies, or just kind of protecting yourself and keeping things kind of on the low down, easy going, easy music, easy stuff, not big problematic things, hopefully. Yes? Okay. Is there anything I'm not asking that you would want to say, hey, this is what people can expect, or any concerns you've heard from people in regards to ketamine, things that they're afraid of?
And from patients that I've had with ketamine, most of them have very good things to say about it. I don't think I've personally had a patient that has had a negative experience with it in my outpatient setting. Most patients really like it, and oftentimes they like to go back to have other infusions or other treatments with it.
What do they say? Why do they like it? What are they saying that is helpful?
Just feel like they loved the experience. They felt like it was life-changing. They felt like they had a rapid, increase in their moods. Those are the type of things that I've heard.
Yeah.
And then they say they just feel different when they've taken the ketamine versus the other drugs, which we use more over very long term.
Right. Right. Yeah. And I've heard really, for the most part, positive things as well. We don't want to minimize negative experiences by any means, but just this idea that kind of like an ego death, or like, access to thoughts I would have never thought I would have, things that used to be so upsetting, now not so upsetting. I have heard a few people say that, it was described as really separating their bodies from their brain, so sometimes when you think about trauma, for example, so much of trauma is lived in our body. And that's part of why you can feel this kind of a break from those kinds of things, that kind of thinking. But along with that, sometimes people say, I thought maybe I had died. I wasn't too sure what was going on, which is also why it's nice to have a guide or a coach or a therapist with you, because they can say, no, you're fine. You're good. You're here. You did not die. But I think that's mostly because of that dissociation, like you're saying, from body to brain, right?
Yeah. My brain was off topic a little bit because you just talking about all the success with it, kind of off topic, and we would have to do a different podcast on it. I was just thinking about the success of psilocybin and MDMA. Hopefully in the future, we're talking about ketamine now, but that is something that, we've got fingers crossed that, that'll be approved down the pipeline here. And MDMA is just something that I'm personally excited to work with, couples and sex therapy as an empathogen, versus where this is more of a dissociative, anesthetic. We're talking about that experience where psilocybin is going to be more hallucinogenic, and then the MDMA is going to be more of an empathogen. So maybe down the line, we might have different uses for these things, but I was just kind of listening for talking about with this whole dissociative experience, mind from body stuff.
Right.
Thinking about the different drugs.
Well, and so we had,
topic,
no, I don't think it's off topic. And I think a lot of people are, I mean, if we're going to just be honest about it, a lot of people are experimenting with these kinds of things, not in medical settings. And so that's obviously something we can't really talk about much, but I think the research is coming through in wonderful ways for all of these kind of either plant medicines or, ketamine's not really a plant medicine, but it's one of these has similar effects. But Utah,
you throw it in the psychedelic category, even though it's an anesthetic. But yeah.
Right. But we just had legislation passed in Utah that is allowing psilocybin and MDMA within hospital settings. Do you want to mention anything about that? That just happened 2 weeks ago or a week ago.
I believe it just happened. I haven't heard too much about it. I've heard from a couple professional colleagues and you guys, so I just have not looked into it a ton. So, I'll hear about things, but until until I'm allowed to prescribe it in the outpatient setting, I just go, okay, well, that's cool. It's got approved. We're going. I know it's progressing. That's what I do know. It's coming. It's going to be more available in the future.
Yeah, and I think we're seeing some really big changes. So I've heard about in a lot of the trainings I've been in that ketamine and plant medicine are really going to change the face of how we even do therapy. So for my field, it's probably both a little bit like overwhelming and also exciting. It's like all these ways that we've learned for so many years to provide therapeutic services is going to maybe shift dramatically with a lot of this. So anyway, yeah, I think we're excited. Jake's on board. I've got several coaches, guides, and therapists on board. So if this is something you'd like to get more information on or get services with us on, by all means, please call our office at Symmetry Counseling. And we'll make sure you have links to that. But basically, you can find us at simcounseling.com. Any final thoughts, Jake, as far as just making sure people understand everything they need to?
If you have any questions, we are open to questions. Just call the office. But I am just so excited to get this going and get started. I feel like this is where the future of psychiatry and therapy is going and trending right now. And I'm really hoping that we're going to see amazing results using all these drugs in the future. So I'm just excited to work with patients who are looking for this kind of treatment.
Oh, yes, I'm super excited too. And like you mentioned, with religious trauma and LGBTQ coming out stories that are, definitely very difficult, especially coming from high demand religions, leaving a faith community, undoing sexual shame and guilt, like so many of the things that I've worked with people over so many years that they just really get stuck in certain types of thinking or lived experiences. I'm so excited to have something that might help us speed that process along, that instead of it taking months and years to kind of undo some of this deconstruction work, that can hopefully be maybe a little bit of a shorter and less painful process for folks. So I think that's why we're so excited about it. So thanks for listening, everybody. And thanks, Jake, for coming on. And take advantage of us for information. Take care, everybody. Goodbye.
Thank you for listening to the Natasha Helfer podcast. To help keep this podcast going, please consider donating at natashahelfer.com and share this episode. To watch the video of this podcast, you can subscribe to Natasha's channel on YouTube and follow her professional page at Natasha Helfer, LCMFT, CST-S. You can find all her cool resources at natashahelfer.com. The views, thoughts, and opinions expressed by our guests are their own and do not necessarily reflect the views or feelings of Natasha Helfer or the Natasha Helfer podcast. We provide a platform for open and diverse discussions, and it is important to recognize that different perspectives may be shared. We encourage our listeners to engage in critical thinking and form their own opinions. The intro and outro music for these episodes are by Otter Creek. Thank you for listening.
There is a place where time slows to nature's pace, and there is space there to find yourself in her embrace. Some places should be left alone. Now tishki say the Navajo, so we can always go. homeland of the heart. 10,000 years of our human history etched on her canyon walls, alongside Earth's mysteries. Some places should be left alone. So we can always go to the homeland of the heart, to the homeland of the heart. Deep in our cities, we sleep without her stars, yet still her presence sustains us from afar. Some places should be left alone. So we can always go to the homeland of the heart, to the homeland of the heart, to the homeland of the heart.